Okay, so thank you so much for joining me today. We want to know, how did Montreal do during the third wave?
Well, the third wave was actually quite interesting because unlike the first and second waves, Montreal wasn't a major epicenter. What we saw in the first and second waves was, unfortunately, Montreal was disproportionately affected. I would even say decimated, perhaps, in the first wave. However, in the third wave, that wasn't necessarily the case. What we saw was that Montreal obviously had an increase in the cases, but we had the testing and the public health capacity to keep things relatively under control. What we did see were there were other regions like, the Quebec City region, Capitale Nationale, like Laval, Lanaudière, and Montérégie, where the number of cases were increasing disproportionately and threatening the regional healthcare systems there. And so that's what was a little bit different about the third wave, is that instead of being Montreal the epicenter, we saw major waves in the surrounding regions.
And now that things are going to reopen, because coming Friday, no more curfew, terrace is going to be able to reopen. So what does that mean for Montreal, given the portrait that we've had of the third wave?
Well, I think we have to be careful against complacency here. Yes, the numbers have been favorable, not only in Montreal, but across the province, in the last week or two. And rightfully so, this means that the government has mapped out a reopening or a deconfinement plan. What we have to remember, however, is that one of the major tools in our toolbox that has allowed us to keep things under control is the vaccination, the high vaccination rates. But we know that there's a pocket of the demographics, which are usually the young adults, where the adolescents are going to be vaccinated shortly, but the young adults and even all the way up to middle age, there's still not optimal coverage there. It's good, but it's not optimal. But unfortunately, these are also the age groups that will tend to go out more to exploit their freedoms as the reopening occurs. So what we don't want is a bad mix-up here, where we have more social activities by people who are not yet vaccinated, because what we don't want to find ourselves is going backwards to where we were 2 months ago, having to re-implement stricter public health measures.
And do you think that removing the curfew is going to encourage just that, what you just said?
Well, the curfew has always been a contentious topic. But what we have to remember is that the curfew in itself is just one tool in the public health bundle to be able to keep things under control. It is not going to be the deciding factor, whether it's on or it's off. It's not going to be the deciding factor. What we have to remember is that the curfew is a reflection of the strict measures that are currently being enforced. If right now we are doing a reopening, it makes sense to remove the curfew to allow more movement to occur among, hopefully, people who have been at least partially vaccinated. What we don't want, unfortunately, is the extreme where people overexploit this and participate in social activities that cannot be regulated, but will unfortunately contribute to outbreaks over the next few months. So yes, it's good news, I think, as a society for us, that the curfew is being lifted. Symbolically, it means that we're heading in the right direction, but I still think it means we need to be prudent and police ourselves in the social activities that we participate in.
And what can we do? What can Quebecers, Montrealers do to avoid a fourth wave? Because it's been in the talks. I think it's not something that was off the table quite yet. I think people are still worried of a fourth wave. So what can people do to avoid one?
Well, I think we have to keep ourselves mentally prepared for the fact that there will almost certainly be outbreaks over the next few months. The question is, how big of an outbreak will each of these things become? Will they become little pockets that can be, controlled by testing, isolating, and public health measures? Or will they get out of control and lead to a wave in our communities that then, lead to increased hospitalizations and perhaps, even increased deaths? So that's where we have to be a little bit careful. How we protect against that is really twofold. One is we really need to continue to follow the public health measures. Even though we are reopening, we are not fully reopening. There is a progressive step-by-step plan on reopening, first allowing low-risk social activities from happening, and then depending on how that goes, perhaps more moderate to quote unquote classic high risk things like indoor activities in larger gatherings. Of course, it depends on what happens with the with the first steps. The other thing that we have to really do is we really need to get those vaccinations going. We have been fantastic so far. We have gotten a large proportion of our population vaccinated, but we haven't gotten enough. We need to make sure that any young adult, so I would mean 19 to the 65 age group, who is perhaps sitting on the fence or hasn't had time yet to go get their vaccine, to go get the vaccine. The sooner they get it, the sooner they're protected, the sooner they protect the others. And of course, we have to roll it out to the adolescents. So as those vaccination rates increase, and as people are judiciously returning to social activities, I think we won't necessarily prevent outbreaks from occurring, but we can do our best to prevent those outbreaks from becoming a fourth wave.
And Premier Legault came back a little bit on his decision. He's keeping Montreal and Laval red zones, and so I want to know, how do you think that's going to impact the island and Laval?
Well, we have to remember that this is not a punishment, right? This is simply because we're looking at the numbers. And of course, Montreal being, the most populated part of Quebec, there's more risk for transmission. There's also greater time required to get numbers down because of the sheer absolute numbers in the city. I don't think that this should be understood as a punishment. And I don't think that what I hope we don't see are people or groups of people sort of quote unquote rebelling and then throwing complete disregard to public health measures and participating in activities they shouldn't be in numbers that they shouldn't be, right? I think what we have to do is just be patient. When we talk about a slower reopening for these areas like Montreal and Laval, what we have to say is it may be another 1 to 2 weeks or so, not months. But if we jump if we get ahead of the horse here and we don't listen to the current instructions for public health, it could last for months. And so the very people who would be rebelling would be the ones who would put all of us back into where we were a few months ago. So please, I would recommend that we just hold tight, that the reopening for Montreal and Laval will happen, but just perhaps not as quickly as in the more peripheral regions.
And I think, like we said last time, it's in the hopes of making this not just temporary, that it lasts longer this time, not just for the summer. So hopefully people understand that.
Well, if we play our cards right, and that is that we get that vaccination going, get the overwhelming majority of the public to adhere to the public health measures, this could make for a very fun summer. On the other hand, if we don't do both of those, the summers can become very challenging.
Thank you so much for your time. I appreciate you joining me this morning. Thank you.
Thank you, Samsara.